Well, welcome everyone. Thank you guys for being here today as a part of the Loyola Stand Against Gun Violence Community Conversations. We're very, very pleased to have you in person. This is our first community conversation that's being held hybrid. So we'll have some people joining us on Zoom. So thank you for being here as well. I want to tell you guys a little bit about Loyola Stand Against Gun Violence. We are a interdisciplinary, interdepartmental, and intercampus group that held mainly on the Loyola University Health Sciences campus where it started, but we are now including Lakeshore campus and Water Tower campus as well, and really hope to advocate for gun safety, against gun violence, and learn more from our other departments and other schools who are doing similar work, or that we can collaborate with our future work. So I'll let Dr. Olson tell a little bit more about his work at Loyola Stand, but we look forward to sharing more about the community with you guys, and especially sharing more about the community conversation. We hope to have monthly events focused on different topics of gun violence and prevention, violence prevention. So I want to introduce Dr. Olson and thank him for being here today as a part of the second community conversation for Loyola Stand. Dr. David Olson is a professor in the Criminal Justice and Criminology Department at Loyola University Chicago, and co-director with Dr. Don Seaman, Olson Interdisciplinary Center for Criminal Justice Research, and a collaborating partner with the Loyola Stand Against Gun Violence Community. Prior to coming to Loyola, Dr. Olson directed Illinois' statewide drug and violent crime control strategy and target evaluation program at the Illinois Criminal Justice Information Authority. During his 35-year career, David has been the principal investigator on more than 11 million in research grants, published more than 100 articles, monographs, and research bulletins, and made more than 100 presentations at professional conferences and to both governmental and legislative bodies. Dr. Olson currently is an appointed member of the Illinois Criminal Justice Information Authority, the Illinois Supreme Court Commission on Pretrial Practices Implementation Task Force, and the Illinois Department of Human Services Firearm Violence Research Group. David is a Loyola alum, receiving his Bachelor's of Science in Criminal Justice from Loyola, his Master of Arts in Criminal Justice from the University of Illinois Chicago, and his PhD in Political Science and Public Policy Analysis from the University of Illinois. Was the recipient of the Assistant United States Attorney General's Graduate Research Fellowship. Dr. Olson, thank you for being here with us today.
Thank you, and thanks for you. Thanks for those who are in person. Thanks for those who are on Zoom. The benefit of being here in person is there are some cookies, so if at any point you get hungry during what might be your dinner hour, feel free to get up and have something. I want to extend my appreciation to Lucia for helping organize this, but also for really being the one that reached out from the medical campus to the Lakeshore campus to talk about what they were doing and to try to engage a broader set of university departments and centers involved in their work. For us, on the social side of things, it's fascinating to hear how they approach things from a public health or medical perspective, and they do have enjoyed the conversations with us. So if there are opportunities in the future to participate in events that Loyola Stands puts together, please take advantage of those. And as was said, we're trying to increase the presence on the Lakeshore campus as well. Before we start, what I'd like you to do is think about what images come to mind when you hear the term firearm violence. When you hear that term firearm violence, what do you think of? What does the victim of firearm violence look like? What are the circumstances around that violence? When you hear the term gun crime or violent crime committed with a gun, how prevalent do you think that is? How often do you think these violent crimes committed with firearms lead to serious injury or death? Spend a second just thinking about what your vision is or what your image is about some of those terms. Before I get into the presentation, I do want to mention a couple things. First is a warning that the topics I'm going to talk about can be upsetting. I'll be talking about things like suicide and homicide and victimization. So I just want to make sure people are prepared and aware of that. I also want to make people aware that September is National Suicide Prevention. And as I get into the material, you'll understand why I emphasize that it's Suicide Prevention Month. Also, if you're not aware, again, this is a collaboration with the Health Sciences campus. When I was preparing this, I said, make sure you remind people of the new number. So there's a 988 number now that people can call. That was previously the National Suicide Prevention Lifeline, which is now the Suicide Crisis Lifeline. Anywhere in the United States, you can call 988 and be connected to support and services. So with that, I want to talk a little bit about what do we mean and what don't we mean by firearm violence. What we do mean within this context and what I'm going to talk about is firearm violence can include crimes committed against other people while using a firearm. So homicides, sexual assaults, robberies, batteries, suicide involving a firearm is also considered a violent form of death. And then lastly, accidental injuries involving firearms is considered a form of violence. What we don't mean by firearm violence when we talk about it is the illegal possession of firearms among people. Oftentimes that's described by some as a violent act, but it doesn't in and of itself constitute violence. Same thing goes with the illegal transfer of firearms. If one person illegally gives another person a firearm, that in and of itself is not violent. And then lastly, the unlawful discharge of a firearm. Shooting a gun illegally, if not at a person, is also not considered a form of firearm violence. Importantly, these latter behaviors that we don't consider firearm violence can obviously lead to firearm violence. But we won't be focusing on those issues around gun control and gun ownership for the purposes of this discussion. In terms of how we perceive the extent and nature of firearm violence, one of the reasons why I asked you to kind of think about what comes to mind when we hear those terms is our perception of firearm violence is extremely important, because it's the perception that oftentimes influences decisions that we make. We vote for, where we live, where we work. Decisions about where we're going to go out for dinner can all be affected by how we perceive our safety, in particular firearm violence. Since most people are not social scientists, most people aren't trained in how to analyze data that's collected by the Federal Bureau of Investigation or the Bureau of Justice Statistics or the Center for Disease Control. Oftentimes our views are formed or shaped similar to the way we form our views about other social problems, like crime, gun violence, or climate change. And that's through what we're exposed to through the media, the local news or national news. In terms of local news or front page news, we have to recognize that, one, homicides are the most serious crime that can occur. But even among those most serious crimes that warrant attention and coverage by the media, there's a lot of research that indicates that there's biases as to which homicides and how homicides get covered by the media. And those shape our perceptions of what victims and perpetrators might be like. The other thing that you recognize if you looked at empirical research about it or thought about it is suicides are rarely covered by the media. Rarely do we hear in the news about an individual committing suicide. Usually it's only when it's someone famous or someone prominent that we might hear about it. And there's also recognized in the media industry in the field that there's a need for balance between identifying what's newsworthy and balancing that against responsible reporting. So I was putting this material together, I actually found documents that are guides to the media on how to cover suicide. Almost a set of ethical behaviors or ethical approaches as to how that should be covered by the media. With the idea that there's concern that depending on how it's covered, it could lead to other individuals contemplating or attempting. I'm not aware of any similar set of guidelines that direct me down how we cover other forms of firearm violence. And then accidental injuries and death are also something that are rarely covered by the media. We don't tend to hear about it a lot. And our hometown news will also be exposed to the media through things like social media, Facebook, or different sources that we may get information from, talk TV shows that may be political in their orientation, that talk about particular issues around firearms, firearm violence, and then also how firearm violence may be portrayed in movies or music. There's different ways our perceptions can be shaped. Rarely do most people rely on empirical information. So what I'm going to do today is, the goal is to provide you with a more objective understanding of the extent and nature of the firearm violence problem, relying primarily on data that we have available that measure and describe the extent and nature of the problem. The fact that the presentation is going to provide a lot of numbers and statistics to understand the problem is in no way intended to diminish or not recognize the harm, the tragedy, and the trauma that firearm violence imposes on individuals, their families, their friends, and society at large. So I want to make sure that before I start talking about numbers and trends and patterns about the problem, that we recognize that each of the individuals that's victimized has a social network, and they themselves are adversely affected, and increasingly we're recognizing the impact of that trauma and that exposure to firearm violence can have on individuals. So to start with, I want to provide a little bit of context as to where we currently are in terms of the firearm landscape in the United States. I'm just going to provide a couple visuals to help you understand where we as a society have been and where we are with respect to our views about firearm ownership and the behaviors that individuals can engage in with firearms. So what you're seeing on the screen is the number of handguns that are produced or imported into the United States for the civilian firearms market. In other words, how many guns are being produced or imported in the United States available for the purchase by citizens. And what you can see from the mid-1960s through the early 2000s, each year around 2 million additional handguns were produced or imported for civilian purchase. Since 2005, 2006, we've seen a dramatic increase in the number of firearms being made available for purchase. And the simple thing you should recognize about supply and demand is a supply is not produced unless there is a demand for it. So you can also look at this as how many additional handguns are being acquired by people in the United States. So it went from an annual average of around 2 million per year to well over 6 or 7 million a year in the last decade. So there are a lot more firearms in the hands of individuals, in homes, and in circulation in our communities. The other thing to recognize or be aware of is over the last 2 decades, our laws have also changed with regard to how we view the ability for individuals to carry concealed handguns outside of their home. In most states, or in every state, they have laws that allow people to carry a concealed handgun. In many states, there's a licensing process, there's a registration process, you take courses, because you have to essentially show that you know enough about firearm safety given that opportunity. Over the last decade, we see more and more states change their laws to shift to what is now called permitless concealed carry. What these laws allow for is if you can legally own a firearm, meaning you are of the appropriate age and you don't have a criminal record that prohibits you from owning a handgun, you can legally carry that firearm in the community. States vary in terms of where you can carry it and what the restrictions are for that. But what we can see here is we went from fewer than 5 states in the country allowing for this relatively easy way to carry a concealed handgun in public to this past year where half of all the states now allow this. So not only do we have more firearms in the hands of people in the United States, but the ability to carry that in public or in the community has also been expanded in terms of that right or that permission under the law. So that at least sets the stage for how we think about firearm violence, right? As a country, there's been a dramatic shift, not only in the prevalence of ownership, but also in how those guns can be carried and possessed in the community. So what I want to do now is start to get you to think about or introduce this idea of the hierarchy of firearm violence, the way to think about the different levels of firearm violence. The most serious form of firearm violence, and fortunately the rarest form of firearm violence, is fatal firearm violence. So the idea with what you're seeing on the screen is, I kind of envision this as a hierarchy, it's a pyramid. At the very top of the pyramid is the most serious form of firearm violence. And as you move down, we get less severe forms, but also ones that tend to be more prevalent. We have fatal firearm violence that results in great bodily harm, firearm violence that results in less serious harm, and then firearm incidents that involve no physical harm. And some of you may be wondering, how can firearm violence not involve harm to a victim? We'll talk about that and explain that. So there's these different forms and these different levels of firearm violence. And then what we also have to think about is, how do they vary, or what's the shape of this hierarchy when we talk about self-inflicted harm? Suicide attempts or suicidal ideation, assaultive or criminal firearm violence like robbery or battery, and then accidental firearm violence or firearm crime. Right, so we've got different levels of firearm violence across different types of firearm violence. When we look at the long-term trend in the number or the rate of people in the United States that have died as a result of firearm violence, what we can see in terms of the long-term trend is we've had periods of ups and downs. If we look at 1993, it was one of the highest rates of fatal firearm incidents in the country. More than 39,000 individuals died as a result of firearms in 1993. But in a relatively short period of time, in the course of 7 years, we saw a 31% decrease in the number or the rate of fatal firearm incidents. So we saw the highest rate on record, and then a dramatic drop in a short period of time. Most recent year that the data is available for, and data for 2021 will be released, I believe, in the next week or two. But we didn't want to postpone this to wait for the data. In 2020, we saw more than 45,000 firearm fatalities in the United States, or a 35% increase in just the last 9 years. So in the last 2-3 decades, we saw one of the largest drops in firearm fatalities and one of the largest increases in firearm fatalities. Now, when we unpack these fatal firearm incidents, one of the things we see is there are some varying trends depending on what form the firearm violence is taking. And also, it helps us to understand which firearm fatalities account for the largest share of fatal gun incidents. So if we look at trends over time in fatal firearm suicides, the relatively consistent and steady changes, right? A relatively slow and steady increase, followed by a relatively slow and steady decrease, and now we're at the point where we're following a relatively slow and steady increase. And when we look at just the last 15 years or so, we can see that we've been on a fairly consistent rise in fatal suicide incidents with firearms. This also coincides with the dramatic increase in firearm ownership that we've seen in terms of guns being put into the civilian marketplace. When we look at firearm homicides, a couple of interesting patterns emerge. The first is that there are fewer firearm homicides than there are firearm suicides. In other words, more people die from firearms at their own hands than die as a result of a firearm homicide. That in and of itself, for a lot of people that I talk to or that I present information to, is a surprise. And they usually say, I didn't know that there were so many suicides with a firearm. Why don't I ever hear about it on the news? And part of it is this idea that media coverage of suicides isn't seen as necessarily always the best thing for media to do. Oftentimes it's seen more as an invasion of privacy for the victim and their family. And so we tend to get a lot more coverage of firearm homicides. The other thing that's interesting about firearm homicide rates is when you look at the ups and downs, the trends, they tend to be a lot more dramatic than with firearm suicides. The trend with firearm suicide is slow and gradual rises and falls. With firearm homicides, we can see relatively brief periods of time where we see enormous increases and enormous decreases, including what we've seen over the last 4 or 5 years. For the last 4 or 5 years, we've seen an unprecedented increase in firearm homicides. With firearm suicide, we've seen an increase, but it's been slower and steadier. Lastly, when it comes to accidental firearm deaths, those numbers are relatively low, and they're one of the most consistent forms of firearm violence in terms of the trend rates. Relatively higher rate in the 1930s and 1940s and steadily going down. There's some debate empirically as to whether or not some of those suicides in the 1930s were, accidental deaths were actually accidents or suicides, but coded in a different way because of the concern for the victim's family. But this slow and steady decrease is also an illustration of what can be done when there is a concentrated effort at trying to educate the public about safe firearm storage, trigger safety locks, educating people about the risks of firearms in homes, similar to what we see with respect to traffic fatalities. Make cars safer, make people more aware of seatbelts and things like that, and we can see. But this helps us to at least recognize that suicide is what drives the majority of firearm deaths. And if we just look at it as a percent, we can see that firearm suicides have accounted for more than 1/2 of all firearm deaths in the United States for the last 90 years. Hopefully that's a perspective or a piece of information that's helpful. In addition to looking at trends over time that are revealed when we examine these different forms of firearm death, when we examine the characteristics of those who die from firearm violence, we also see different patterns depending on the form that firearm fatalities take. And this is where I want you to recall when I ask you, what do you picture or what do you think of when you hear of a victim of firearm violence? What do they look like? What's their age? What's their race? What's their gender? Where do they live? What kind of environment are they living in? One thing that's consistent across all the different forms of firearm death is the vast majority of victims are men. 85% or higher of all gun homicides, suicides, and accidental deaths involve minutes. Obviously, they all also involve firearms. But when we look at different characteristics, we start to see some different patterns emerge. And so I'm going to explain a little bit about what this graph is telling you and how to interpret it, and then give you some time to kind of think about it. So when we look at the racial composition of victims of fatal firearm incidents, if in your mind you were thinking suicide, characteristics of fatal gun suicides is they are predominantly white men. I said earlier that across all the forms it's primarily men. And remember that gun suicides occur more frequently than any other form of fatal firearm violence. So primarily white men. We talk about homicides, primarily African American. And when it comes to accidental deaths, again, primarily white men. So if when you were thinking about what does a fatal firearm victim look like, if you're thinking white man, I'd probably be surprised because rarely do we hear about that. Rarely is that the vision that we're given in the media of who the victims are. But when we realize that suicides are a different form of gun violence with different reasons behind that, and a different population effect, we can start understanding that. There's differences in terms of the racial composition. There are also differences in terms of age. Like the average age of a firearm suicide victim is close to 50 years old. The average age for a firearm homicide victim is closer to 30 years old. And then accidental deaths fall somewhere in between. The suicide victims are primarily white men that are older. Homicide victims are primarily African American men that are younger. And oftentimes when we think of firearm violence, we think about young black men who are disproportionately affected. The last way to look at this or think about it is what is the rate of fatal firearm death by the different places where people live. So what you see in this last set of bars on the screen is the suicide rate in metropolitan areas compared to rural areas. Again, suicides account for the largest share of fatal firearm incidents. And the highest rate of those is in rural areas. When we look at homicide, the higher rate is in the metropolitan areas, but not necessarily that much higher than people would expect. And then lastly, it's hard to see on the screen because the rate is so low, but the rate of fatal firearm incidents is also higher in rural areas than in metropolitan areas. So what we view as the characteristics of fatal firearm victims is going to vary dramatically depending on what form of firearm violence we're envisioning or thinking about. The other thing that's important to point out or keep in mind, I'm not going to get into a lot of detailed information about individual states and things like that because I do want to keep this broad, is we have to recognize that there is a lot of variation in the rate of firearm deaths, the forms that firearm deaths take, and the characteristics of victims, not only across the states, but across cities and across neighborhoods within cities. And so when we look at the overall rate of fatal firearm incidents in each state, what we can see is the rate varies from less than 5 per 100,000 residents in some states to over 20 per 100,000 in other states. And I just included a couple states on the axis just so that you can kind of identify where some of them are. I included the two ends of the spectrum. So Hawaii has the lowest rate of firearm deaths. Alaska has the highest rate of firearm deaths. You see where Illinois falls, kind of in the middle, a little bit towards the lower end. And then you see Washington, D.C. and where they are. So the rate of firearm deaths is graphed along the left-hand axis. But what we can also look at is what percent of all homicides, what percent of all firearm deaths involve firearm homicides. So what the red line is showing you, which is graphed along the right-hand axis, is out of all the homicides that occurred in, for example, Hawaii, what percent of those fatal firearm incidents were homicides? And it bounces around a lot, the line's all over. Now you see why I specified which bar and line was Washington, D.C. Washington, D.C. has a relatively high rate of fatal firearm incidents, and more than 80% of those firearm fatalities in Washington, D.C. are from homicides. There's 5 places where more than half of all the fatal firearm incidents are homicides: Washington, D.C., Illinois, Louisiana, Maryland, and New Jersey. In very different states in a lot of ways, right? But very different forms and rates of fatal firearm incidents. There's also 6 places where less than 10% of all the fatal firearm incidents involve homicide: Hampshire, Idaho, Maine, Vermont, Montana, Wyoming. To look at the state with the highest rate of fatal firearm incidents, Alaska, you see that they have the highest rate of fatal firearm incidents, but only about 20% of those were homicides, meaning 80% were the result of firearm suicides. So this gives us a sense of how much variability there is across the country. And there's plenty of folks who do research that try to explain why is it that there's this much variation. How much of it is the characteristics of the population, how much of it is the characteristics of the policies that are in place in those states. So that's an area that's got some interesting stuff. The last thing I want to point out with this is to recognize that even within cities, though, there can be a lot of variation in the firearm fatality rate. In some neighborhoods in Chicago, for example, just the firearm homicide rate is more than 80 per 100,000 residents. In other words, in some neighborhoods in Chicago, the rate of fatal firearm incidents is 4 times what it is in the state that has the highest rate. So, talked a lot about fatal firearm incidents, focused on that. What I want to do now is talk a little bit about whether or not we recognize or envision that gun violence can be less than lethal. When we think of gun violence, we assume that it always involves a lethal outcome. For some of the forms of firearm violence, particularly suicide, in most instances when an individual attempts suicide with a firearm, there is a fatal outcome. So with firearm suicide, there isn't necessarily this hierarchy that there's a lot of deaths followed by a larger number of attempts and so forth. Right? The survival rate for firearm suicides is extremely low. But we also have to recognize that down at the very bottom, in terms of firearm incidents that involve no physical harm, there is the potential that individuals have suicidal ideation involving firearms, that they think about the attack. And that number is likely much larger than the number that actually attempted or die as a result of it. On the other hand, there's other forms of firearm violence where the outcome is usually not a fatality. For example, with accidental firearm injuries, again, it's the least prevalent form of firearm death. There's roughly 36 individuals who are injured where it is not a lethal outcome, for every 1 person that dies as a result of a accidental firearm incident. In other words, there are a lot of people that fall into the group of experiencing great bodily harm, and even larger, they experience some harm, And there's probably a lot of people that never seek medical treatment because they were playing with a gun, get fired, and unfortunately didn't hit anybody. That's a firearm incident. It could be traumatic, but it's not going to result in those outcomes. So I want to spend the last part of my time talking about is this hierarchy as it relates to assaulted firearm violence or crime. And to do that, what I want to start with is placing firearm violence into the larger context of crime. What we're exposed to through the media tends to be skewed towards violent crime, and in particular, firearm violence, and even more particular, lethal firearm violence. But we have to put it into the larger context. In the year 2000, it's estimated that there were somewhere around 17 million criminal victimizations in the United States. Most of those involve people having property stolen from them. Garage burglarized, or backpacks stolen, those things. Almost 20% involve simple assault. Threats or pushing that was criminal, but not necessarily serious in terms of the harm to the victim. But then we start getting into the smaller slices of the pie that do involve more serious forms of violence. Overall, about 9% of all crime in the United States would be considered serious violence, meaning a weapon was involved or there was victim injury involved. You can see on the slide that a very small slice of that involves a serious violent crime committed with a firearm. Again, this isn't to diminish the seriousness of victimization or the importance of understanding the extent to which of firearm violence, it's to put it into that larger context. And at the end, I'll explain why it's important for us to recognize that firearm violence is a small share of the crime problem. But do we appropriately focus on that, or do we spend a lot of time focusing on the blue areas of this pie? The crimes that, while they occur with frequency, they don't involve as much harm to society or the community. So when we as criminologists study crime, there are different ways that we measure crime. One is that we use information about crimes that people report to the police. The police collect information about that, and then they share that information with the FBI, and that's how we come up with crime statistics for the United States. Within the next month, the FBI will be releasing the crime statistics for last year, and you'll pay attention because you've been thinking about it now, and there'll be all sorts of stories about whether or not crime went up or went down, or what crimes went up or what. But what that information relies on is crimes that are reported to the police. The other source that we as criminologists use is surveys that are done, the largest of which is called the National Crime Victimization Survey. It's designed to measure the extent and nature of crime, regardless of whether or not the individual reported that victimization to the police. When we look at that, what we find out is there is a lot of crime that occurs that never gets reported to the police. And generally, the patterns that we see is that if a crime is less serious, if there's not victim harm, if the perpetrator and the victim knew each other, that it's less likely to get reported to the police. Crimes that involve weapons, crimes that involve strangers, crimes that involve harm are more likely to get reported to the police. So we would assume that given the serious nature of firearm violence, that most firearm crime would get reported to the police. And that's true, to a degree though. Research by one of our colleagues, Dr. Maribeth Rizzi, found that nationally, as well as in Chicago, about a third of all violent crimes committed with a firearm are not reported to the police. So one way to recognize, think about that is, if you thought there was a lot of violent crime with a firearm based on what you hear, realize 1 out of every 3 crimes isn't being reported to the police. Oftentimes it's because there wasn't an injury involved. And realize when we talk about firearm crimes, we're talking about threats with a firearm, robberies with a firearm, those kinds of things. Men were less likely to report their victimization to the police. But the victim's sex doesn't affect reporting of other violent crimes. So there's something unique about firearm violence that changes reporting. Dr. Rizzi's research also found that the rate of reporting of firearm crimes was the same in Chicago as in other large cities in the country. So oftentimes we hear about concerns that the public isn't providing enough information to the police to help them solve crimes. At least this metric of the public providing information to the police about crimes that do occur appears to be no different in Chicago than other large cities. So when we look at why violent crimes with a firearm aren't reported to the police, one of the things that we see, or one of the patterns that we see that I think is important to think about, is 1 in 3 victims who did not report the crime to the police responded to the National Crime Victimization Survey that they didn't think the police could or would do anything to help them. In other words, they didn't have faith that the police would do anything or care about it. Yeah, these are serious crimes involving the threat or robbery with a firearm. Another 15% indicated that they feared reprisal. They feared that they would be re-victimized if they reported the crime. When we compare those patterns to serious violent crime that doesn't involve a firearm, we see that there's different patterns, right? For those non-firearm violent crimes, only 20% say they didn't report because of the police. And only 8% said that they feared reprisal. Right? So there's something unique about firearm victimization in terms of why people don't report it to the police. And if we recognize that law enforcement can play a role in identifying perpetrators and either holding them accountable or using the justice system to ensure they get the services that they need, we have to consider how we improve that gap. So when we look at non-fatal firearm victimization in the United States using the National Crime Victimization Survey, we see a trend over time that in many ways is extremely consistent with what we saw with not only firearm homicides, but also that we see in terms of violent crime in general. Dramatic drop in non-fatal firearm victimization from the early 1990s to the early 2000s. And then it's been relatively stable since then. A couple of the important things to note with this, one is the trend is encouraging, is hopeful, but it also contradicts a little bit what we saw with firearm homicides in the last couple of years, which may suggest that firearm violence is becoming more lethal, more targeted, more focused. The other thing that's important to keep in mind with this figure is when you look at the number of victimizations each year. During the 2000s, on an annual basis, there was anywhere from 400,000 to 500,000 firearm victimizations that were not fatal. That's important to put into comparison with the 15 to 20,000 firearm homicides to get a scope of how prevalent lethality is when it comes to firearm crime. So the last couple things I want to do is start to help us think about or build this understanding of the hierarchy. So when we look at the extent to which being the victim of a firearm crime leads to injury or leads to a fatal outcome, one way we can look at it is look at all of the firearm crimes and come up with the likelihood of different outcomes for every 100 crimes. So out of every 100 firearm crimes that occur, about 15 result in the victim being injured. Again, keep in mind the nature of this victimization and the relatively low rate of victim injury. These involve primarily people being threatened with a firearm, a robbery with a firearm, somebody pointing a gun at an individual and threatening them, Research indicates that if there is no victim resistance, if the victim complies with the robbery, then the violence usually doesn't escalate. The offender got what they wanted, they leave. It's when there's resistance that violence can escalate, and it can lead to the individual being injured. It can lead to serious injury. It can lead to a gunshot injury. And as you look at these bars, realize that not all of those injured are injured as a result of a gunshot wound. They're hit with a firearm, they're hit with some other weapon or some other thing. Out of all the firearm victimizations, only about 5% result in a gunshot injury. And an even smaller share of those result in a fatal gunshot injury. The idea with this, again, is not to diminish the seriousness of firearm violence or firearm homicide, but it's to help us to recognize that most firearm homicides are the result of other forms of violence that escalate. The other way to look at this is if we only focus on firearm homicides and those victims and those people that are affected by that victimization, we miss 95% of the people that are exposed to firearm victimization and the trauma that comes with that and the impact that that has, their lives and their behaviors and those of their friends and family. The last couple things, and then I will be done, is to kind of fill in a little bit about this bigger picture of where firearm violence and gun violence and fatal incidents are. So this is just kind of building on the previous graph that I showed you. Out of all the serious violent crime, only 9% of all serious or of all crime is serious violent crime. And of all that serious violent crime, only a small share involve firearm violence. 2% of all crimes in the United States involve firearm violence. And out of those crimes that involve firearm violence, an even smaller share involve a fatal outcome. So this helps us kind of follow the train, right? Of how much crime is there, how much of that is firearm related, how much of that involves injury, how much of that involves death. And this isn't to suggest that it's not a problem or that it's not serious, but rather it reveals how if we were to focus on what we would all agree to be the most serious form of victimization, that being firearm violence or fatal firearm violence, it is something we can focus on. It's a relatively smaller problem than thinking about crime in general or all crime. The last piece of data that I want to show you is also something to help us recognize that relying on the criminal justice system alone to address firearm violence or even firearm crime has its limits. One thing that we have to recognize is, one, not all firearm crime gets reported to the police. For every 100 firearm crimes that occur, little under 70 get reported to the police. But out of those crimes that the police know about, their ability to solve them and to identify the perpetrator is also unlikely. Keep in mind that firearm homicides, being the most serious form of firearm violence, are oftentimes focused on and solved at relatively high rates. But relatively high rates is relative. In Chicago, the clearance rate for homicides is around 50%, meaning that 1 out of every 2 homicides, they stop or they clear. But most crimes with a firearm are not homicides. So what we can see here, out of every 100 firearm crimes that occur, less than 20 result in the individual who perpetrated the crime identified. Given that relatively low rate of identifying the people in the community who are actually engaging in firearm violence, we have to recognize that relying exclusively on the police to address the problem has its limits. So with that, I wanted to just offer a few parting conclusions to talk about the implications or what I see as the conclusions to this. The first is to reemphasize or reiterate that firearm violence is traumatizing individuals, families, and communities. What we need to do is recognize the enormous amount of non-fatal firearm utilization that's often not seen. We're not aware of it, we don't hear about it. And oftentimes it's not reported. Fatal firearm violence involving suicides and homicides have increased in recent years. There's no arguing against that. Those forms of firearm violence have gone up. Suicide rather consistently and steadily for the last 15 years. Homicide really in the last 5 or 6 years. But we also have to recognize the characteristics of victims very differently or very dramatically. The reasons, the underlying reasons for these forms of firearm violence likely vary as well, with the exception that they all have the common denominator of a firearm being involved. Violent crimes committed with a firearm account for a really small share of all the crime, and even a small share of all the violent crime. But it is the most significant in terms of the harm and trauma that it causes, and therefore it should really be the focus. And a lot of criminal justice practitioners are recognizing that spending inordinate amounts of resources on enforcing drug laws or minor crimes like theft, while it's important to hold people accountable and get them the treatment they need, if that comes at the price of not providing sufficient attention to this most serious form of crime, then we need to rethink that focus. Then lastly, we can't rely exclusively on the criminal justice system to address this, in part because it's clear that they can't identify all of the perpetrators. There's likely factors that drive certain forms of firearm violence, like suicide, that are well beyond the scope of what law enforcement tackle. And they have challenges identifying who the perpetrators of firearm crime are. So with that, it's a good segue into recognizing that we, meaning we at Loyola, we who study this issue need to recognize that coming up with effective solutions requires first starting with this broad understanding and this foundation of what the extent and nature of firearm violence is, but also figuring out ways to collaborate together to come up with effective solutions. And that's really the impetus behind the Loyola Stands project. It's combining social scientists, public health professionals, and researchers, medical professionals coming together regularly to talk about what we're learning, what we're doing, and what solutions we can offer. So, thank you all for your attention and your attendance. I'm not sure if there's questions or how you want to end this, so I'll leave it up to you. See.
Have some questions that oh, sure.
If any of you have questions.
What do you think is the first obstacle we must tackle to stop gun violence?
Can I have 10 firsts? I think one of the obstacles is hopefully what we're trying to achieve through this kind of dissemination of information. I think a lot of people view the gun violence problem in terms of the characteristics of who is a victim of firearm homicides. Young Black men in urban areas. That's what they envision as the gun violence problem, and for most people, they don't see how that gun violence problem affects them. Hopefully with this, we realize that the gun violence problem, when we properly frame it, to recognize that suicides are a form of gun violence. And that non-fatal gun crime is an issue that it's seen as something that does affect everybody. Every community, rural communities have a higher rate of fatal firearm suicides. And that's what in many states drives their firearm violence problem. And so I think part of it is just recognizing that this is a problem that affects everybody. And not just affects everybody financially or in terms of the program, it affects everybody personally, because the problem does cut across racial and ethnic and income lines. I don't think a lot of people recognize that.
Is gun violence?
Is gun violence a solvable problem? I think that we can develop policies and practices that can reduce the prevalence of gun violence. We did it in the 1990s. We've done it at different points in time. So I think there are, I'm an eternal optimist. I always think there's ways that we can reduce the extent and nature of the problem. Can we ever eliminate it? Probably unlikely, given how people view the conflict between what they see as rights that are granted to them in terms of gun ownership. So we will likely always have guns, and because of that, we will likely always have different forms of gun violence. The hope would be that through education and awareness and services and things that get at the root reasons why people might be involved in committing crime with a gun, or that they see suicide as a way out. If we can address those things, then we can hopefully address the problem.
For the less than 20% figures, violent crimes committed with firearm, is that just homicide, or does that include like determined?
The clearance rate for firearm crimes is really just crimes committed with a gun. So if you're in Chicago, if you listen to Chicago news, in addition to firearm homicides, they talk a lot about shootings, right, where someone's been shot at or shot with that. Those crimes are also rarely solved. Right? So when we talk about less than 20% of firearm crimes are solved, it means of all the crimes committed with a firearm, less than 20% are solved. It's a little higher for homicides, but it's still only around 50%.
Is the Center for Criminal Justice Research working on anything specifically for firearms?
So we're working on a few projects. We are working on, we completed research that helped to better understand the characteristics of individuals who illegally possess firearms and how the justice system responds to them. We are doing research to evaluate some intervention programs in Rockford that are designed to try to reduce firearm violence among individuals. And we're also working with the Illinois Department of Human Services as they launch their effort to implement a public health approach to firearm violence. So we're working with them to identify the communities in the state of Illinois that have the most serious gun violence problem, which is where we presented some of this information to them, but on a more Illinois specific basis. Not only helping them identify where in the state these resources are most needed, but what types of interventions can be used to prevent gun violence. So it really is about prevention and early intervention and things like that. So we're doing a few different projects covering prevention, but also how the justice system responds to the firearm crime. Another question?
Yeah, I was going to ask. Why does society make it so difficult to tackle gun violence as a public health issue?
I think it's just, it's tough to speak for society. I think one of the challenges is people oftentimes see violence as a direct threat to them. And their response oftentimes is they'll do things to protect themselves. Right? Part of why we've seen such a large increase in gun ownership, in part, is a view that government has failed to protect society, and so a lot of people feel as though they need to protect themselves. And that's reflected in the change we saw in the earliest slides about changes in the law where half of the states allow you to carry a concealed handgun without going through any permitting process. Part of that is because citizens want that right to protect themselves. So I think the challenge is that society looks for very simple answers for really complicated problems. And so they may think about public health as an approach, but if it's preventative, if it's long-term, if it doesn't immediately satisfy what they think would work, they're less inclined to support it. And that's why we tend to see policies that increase the penalties if you commit a crime or those kinds of things. But if we're solving very few of the crimes, we don't do those things. I think we got to cut it off there. I appreciate everybody for coming, both on Zoom and in the audience. And feel free to reach out to me or my colleagues in the Center for Justice Research. Thank you.